Hello, my name is Leslie Osorio, and today we'll be talking about childhood obesity. We will look over what obesity is in general, then what childhood obesity is specifically. With childhood obesity, we'll be looking at the different causes, prevalence, risk factors, and possible solutions to address this issue. What is obesity? Obesity in general is defined as abnormal or excessive fat accumulation that is a risk to one's health. Obesity is something that affects both adults and children. We know this because the rates of obesity in both populations continue to rise worldwide. We know from the title that childhood obesity affects children. This can affect their daily life, and as adults we need to be more aware of this and be informed. Here's a quote from Melody Barnes, who is the chair on the Childhood Obesity Task for the White House when President Obama was in office. Parents across America are deeply concerned about their children's health and the epidemic of childhood obesity. One of every 3 children is now overweight or obese, a condition that places them at greater risk for developing diabetes, heart disease, and cancer over the course of their lives. To know these risks and what level one needs to act on, we need to know the type of obesity there are in children. As we know, there are 3 kinds of classes. Class 1, which is a BMI less than or equal to the 95th percentile. Class 2, a BMI of less than or equal to 120% to 140% of the 95th percentile. And finally, Class 3, which is a BMI of less than or equal to 140% of the 95th percentile. There are 3 main causes: lifestyle, genetics, and behaviors. Children nowadays spend more time indoors on electronics and not being outdoors, which can affect them immensely. Genetics is also a cause because if there is a history of being overweight in their family, it will most likely mean the child will be overweight as well. And finally, the behavior of a family can affect a child because if the family is not making healthy choices, the child will follow. The activeness of a child is a cause as well because it is recommended that children are active and avoid foods and drinks that have too many calories than what their bodies need. Some common symptoms are difficulty sleeping, shortness of breath, sweating more than usual, and excess body fat. Childhood obesity also has the symptom of type 2 diabetes, which is why it is important to take the necessary precautions to avoid childhood obesity. Just in the United States, there are 14.7 million children and adolescents with childhood obesity. If we look closer, 12.7% of children ages 2 to 5 are classified as obese. 22.2% are ages 6 to 11. And 12 to 19-year-olds, there are 20.7% who are classified as obese in the United States. Eating patterns, lack of exercise, socioeconomic status, and psychological stresses are all risk factors for children. A unhealthy eating pattern is dangerous for children. They need to be following My Plate guidelines. The lack of exercise for children is a major risk factor, especially in children now because they are so surrounded by electronics that they don't spend enough time outdoors being active. Psychological stress is a big risk factor for children. The stress of personal or family issues can lead to a child looking to food for comfort, which can lead to them not eating right and not taking care of their health properly. Along with these psychological stresses, socioeconomic status is a big risk factor for everyone. Having limited resources can lead to a family buying frozen meals or not having enough to buy healthy options. Some preventative factors are practicing sports, eat less screen time, drinking adequate amount of water, and most likely eating healthy. You don't have to do all of these preventative measures at one time, but by starting to do one of these can help you. By simply starting to drink more water can help one lose weight, then by starting to make healthier eating choices. Later, one can join a sport or even just walk outside for a couple of minutes instead of being inside watching TV can help.